Do you think the change in the smear policy so that 25 and over is the beginning of the screening programme is going to cause an increase in the number?
Interestingly, in Wales, Scotland, and Northern Ireland, you can have your smear from the age of 20, but in England it's 25. So you can either move to one of the provinces, you can, or whatever. The reason why it went to 25, and obviously Wales, Scotland, and Northern Ireland then went back to 20, but the reason it went from 20 to 25 is because young girls their cervix is still developing. And when I say young girls, adolescents and teenagers and women in their early 20s, the cervix is often still developing, and so women at the age of 20, say, will sometimes have borderline or mild smears. But if you don't do anything, at 25, one of two things will happen. The smears are they've either cleared their human papillomavirus and their smear will have gone back to normal, or it will progress to moderate to severe. It's only very, very, very small percentage which will go on to develop cancer from having a mildly abnormal smear between the age of 20 and 25. So the argument is, by not doing smears until the age of 25, you don't treat this whole group here, which their smear would have gone back to normal by the age of 25, and you only treat this group. And women between the ages of 20 and 25 is the most reproductively active. So these are lots of young girls who haven't had any children at the age of 20, but might have had two by the age of 25. You're starting to treat them at an earlier age. You might end up having to do a second treatment. You're then affecting their fertility. So that's the argument for not doing smears until the age of 25. However, obviously the counter-argument is you will miss those few who have cancer at the age of 25, but could have been treated before it became cancerous at the age of 20.
What is the incidence of cancer in the under 25s?
The incidence of cervical cancer under the age of 25 is very low.
But it's relatively high in the under 35s?
Yes. It's in that age group that most people develop cervical cancer.
So if you start having sex when you're 12, is your chances of having cervical cancer much higher by the time you're 25 than it would be if you didn't start till you were 18?
Well, the age of first intercourse is a risk factor. Early age of first intercourse is a risk factor for cervical cancer. However, at the age of 25, most girls who develop cancer, when you look back at their history, a lot of them have actually had a normal smear in between the age of 20 and 25, and this is because young women who under the age of 25 who develop cervical cancer tend to develop a particularly aggressive type of cervical cancer, and therefore they've often had a normal smear at the age of 20, a normal smear at the age, because of course until relatively recently we've been doing smears from the age of 20, and in some cases we still are doing, But when you look, they often have had a normal smear and go through the whole process of borderline mild, moderate, severe cancer in a very short period of time, and therefore doing a smear every 3 years wouldn't change things.
Does there reach an age when you say, right, you don't need to have smears anymore?
Well, the current England guidance is smears every 3 years from the ages of 25 to 50. And if you've had negative smears in the 10 years prior to the age of 50 and no previous treatment, then you go to 5 yearly recall up until the age of your 65th birthday. And again, if you've had negative smears in that 10-year period, you get taken out of the cervical screening programme. A woman who has had negative smears up to the age of 64, 65 is virtually no chance of developing cervical cancer. Or if they do develop cervical cancer, it's a rare type of cervical cancer that isn't picked up by smears.
If you're 22 in England and you want a smear, can you have one?
Yes. If you want to have a smear, then I don't see any reason why not, and certainly that's the recommendations from our body, the British Society of Colposcopy, that if a patient requests a smear, they should have one. The most important thing in this young age group is actually symptoms, and possibly making the 20 to 25-year-olds aware of symptoms of cervical cancer. And in that young age group, that's bleeding between periods, bleeding after intercourse, discharge that doesn't clear up with treatment, and they've had negative swabs ruling out sexually transmitted infections. That's the most common symptoms of cervical cancer. So in this age group, it's a difficult argument. I know recently the NHS in England have decided to keep it at 25, and that's really because of the discussions around treating this normal group. And certainly in the last few years, when we have under 25s come to colposcopy, we try to take a very conservative approach with them. So essentially, and that does increase anxiety, because if you're 20 and you've got a mildly abnormal smear, the understandable reaction of a 20-year-old with an abnormal smear is they want their smear to go back to normal and they want some treatment. And actually it might be more appropriate just to leave them alone, do their smear 6 or 12 monthly. If it stays mild or gets better, great. If it goes to moderate or severe, treat them. And so the argument in England is to not do that smear in the first place and allow that process to happen. But obviously the provinces have decided to take a different track.